Good morning, class. Today we will be talking about anatomy of larynx. Before talking about anatomy, let us have a brief review of embryology of larynx. So, in the early fetal life, hypobranchial eminence is formed in flow of primitive pharynx between the ventral end of third and fourth and second arch. In third week, the ventral foregut becomes demarcated as laryngotracheal sulci. Larynx, trachea, and lungs develop from this groove, which is a ventriculum posterior to hypobranchial eminence at fourth week. Now you can appreciate this is tuberculum empire. This is what is going to be future hyoid bone. This foramen cecum, popula, the first arch cleft, second visceral arch, porcula, and this is the laryngotracheal groove. Now the laryngotracheal sulcus is formed. This is the pharynx. This is the developing epiglottis. This will be the piriform recess. This is the bulge of the arytenoid swellings on both sides, and this is the laryngotracheal groove. Now, as we talk about development of larynx, two swellings develop lateral to laryngotracheal groove, which forms the arytenoids and epiglottic folds. Primitive epiglottis of popula is formed by hypobranchial eminence in the midline. At 8th week, primitive vocal cord is formed between vestibule and upper trachea. By 10th week, this mass splits sagittally, forming both pairs of vocal cords. The development is complete by 10th week with the formation of cricothyroid joint. Now let us see how we divide larynx anatomically for the ease of understanding. So it is divided into three areas. The supraglottis, that area is above the level of two vocal cords. Then the glottis, this is the area of the two vocal cords, anterior and posterior commissure. And the subglottis, the area beneath the two vocal cords extending 1 centimeter below the two cords. The supraglottis comprises of the epiglottis, laryngeal aspect of A folds, arytenoids, ventricular bands, and ventricles. Looking at the framework of larynx, as we open the larynx, this is the epiglottis. These are the epiglottic folds. This is the corniculate cartilage, cuneiform cartilage. These will be the arytenoids, and these are the oblique arytenoid muscles. This is the transverse arytenoid muscles. This is the posterior cricoarytenoid muscle and the cricoid cartilage. Coming to the cartilages of and joints of larynx. The larynx is formed by cartilages, that is thyroid, cricoid, arytenoid. These are hyaline cartilages, and they ossify after the age of 25 years. Then there are few elastic cartilages, that is epiglottis, corniculate, cuneiform cartilage, and the tip of arytenoid cartilage. There are two joints, cricoarytenoid joint, which is a synovial joint. It is rotatory and has rotatory and gliding movements. Another joint is cricothyroid joint, which is a synovial joint. Now, as you look at the larynx from interior aspect, this is the hyoid bone, this is the thyroid membrane, this will be the thyroid cartilage, this is the thyroid notch, then the cricoid cartilage, the cricothyroid membrane, and the first tracheal ring. Now there are various ligaments and membranes of larynx which divide into various areas. So first of all is the medial and lateral thyroid ligament, then the thyroid membrane, then medial and lateral cricothyroid ligament, conus elasticus, cricotracheal membrane, and the quadrangular membrane. Now, this is the quadrangular membrane, and this is the conus elasticus. There are various extrinsic muscles of larynx which can be studied under the head of elevators of larynx, depressors of larynx, and tensors of vocal cord. Now, the elevators of larynx are stylopharyngeus, salpingopharyngeus, palatopharyngeus, thyroid, mylohyoid, stylohyoid, digastric, and genealoid. Now, these all muscles help to elevate the larynx during the process of swallowing. Then the depressors of larynx are sternohyoid and sternothyroid and omohyoid. Tensors of vocal cord are cricothyroid. There are various intrinsic muscles of larynx which help in the movement of vocal cords and the various movement of various joints. The aryepiglottic and oblique arytenoids, then posterior cricoarytenoid, lateral cricoarytenoid, thyroarytenoid, and interarytenoid. Now, the cricothyroid is the external tensor of the vocal cord. Thyroarytenoids, these are the internal tensors of the vocal cords. Thyroepiglottic and interarytenoid, aryepiglottic, these are the other muscles. Now, coming to the movement of the vocal cord, how the vocal cord movement takes place. So, there are two groups, adduction and abduction. For adduction, it is the movement of the vocal cord. For abduction, the posterior cricoarytenoid, it moves in this direction, and this displaces the muscular process of arytenoid, the vocal process of arytenoid into the abducted position, hence opening the laryngeal inlet. The adductors of the vocal cord, which is attached to the this is the lateral cricoarytenoid, and when it moves, contracts, it facilitates the movement, adduction of vocal cord into the midline and helps in closing the glottis. The tensors of the vocal cord, these are cricothyroid, external tensor. Relaxers are the thyroarytenoid, internal, and vocalis, and the laryngeal inlet, the opening of the laryngeal inlet by means of thyroepiglottic, and the closure is by interarytenoid and the aryepiglottic muscles. Coming to the nerve supply, the larynx is supplied the supraglottis area and upper surface of vocal cord supplied by internal branch of superior laryngeal nerve. This is the internal branch of superior laryngeal nerve. The lower surface of vocal cord and subglottis is supplied by the intrinsic muscles of supplied by the recurrent laryngeal nerve. Now the cricothyroid is supplied by the external branch of the superior laryngeal nerve. Then there is a Galen's anastomosis, which is a rich intercommunicative network between the right and the left side and the superior laryngeal nerve and recurrent laryngeal nerve. The vascular supply is by superior laryngeal branch of superior thyroid artery, which supplies the supraglottis, and the inferior laryngeal branch of inferior thyroid artery supplies the subglottis and under surface of vocal cords. Now, what are the functions of larynx? Basically, it is protection of the tracheobronchial tree. How does it protect? There are three tier sphincters. Number one is the laryngeal elevation by mylohyoid, laryngeal tilting by stylopharyngeus, and relaxation of cricopharyngeus. Then the cough reflex, cessation of respiration. Another function is respiration. Then the third function is floration. And finally, it helps to increase the intrathoracic pressure while lifting weight or strain. Functions of larynx, phonation and speech. Can be classified as, it can be divided as pulmonary phase, laryngeal phase, and supraglottic or oral phase. In pulmonary phase, the column of air in subglottis space by exhaled air from the lungs by contraction of thoracic and abdominal muscles. Laryngeal phase, the subglottic air pressure opens the adducted vocal cord and small puffs of air are released, causing vibration of elastic vocal cords. In the supraglottic or oral phase, the vibrating vocal cord produces sound, which is amplified by resonance of pharynx, mouth, nose, and chest, modulated by lips, tongue, palate, pharynx, and teeth. Now let us have a look at the mechanism of phonation. The most commonly understood, most well understood is the myeloelastic theory of aerodynamics by Vandenberg in 1950. In this, the myeloelastic phase, that is the elasticity of vocal cord, helps in closure. Then in aerodynamic phase, the vocal cord in abducted stage of inspiration, vocal cord in adductive space position in expiration, pause, positive subglottic pressure, and the sudden separation of vocal cord produce sound due to elastic recoil and vibration of vocal cord during air space. The intensity of and duration of sound is modulated by air pressure, by lungs, and the subglottic pressure built up by adduction of vocal cords. Pitch of the sound is the vocal cord vibratory mass and the laryngeal adductors and tensors. The frequency of vocal cord varies with changes in length and breadth, elasticity, and extension of the vocal cord. Quality of timbre it depends on the resonators and articulators. Now there are different positions of vocal cords. This is the median position, when both the vocal cords are tightly adducted and closed. Paramedian position, when they are open 1.5 millimeter away from the midline. The cadaveric position, then they are 3.5 millimeter away from the vocal midline. Then 7 millimeters away from the midline and 9 millimeters away from the midline. That is full abduction. Now, an adult and an infant larynx have maybe it is different. They are not the same. Let us see the differences between the adult and infant larynx. In adult, the vocal cord is at the C5 level, and in infants, it is at the level of C3 and C4. An adult cannot swallow and breathe simultaneously, but in infants, the epiglottis and soft palate make a channel so infant can breathe during sucking. In adults, glottis is the narrowest part of the larynx, whereas in infants, the subglottis is the narrowest part of the larynx. In adults, thyroid cartilage is prominent and known as Adam's apple. There is no Adam's apple in infant larynx, and the arytenoids are large, epiglottic omega shaped, and cricoid is smaller, and thyroid cartilage is more flat. There are few spaces in the larynx which has got surgical importance. The pre-epiglottic space or space of Boyer. This space is continuous laterally with para-epiglottic space deep to the quadrangular membrane and superior to ventricle. Cancers of infrahyoid laryngeal surface or epiglottis spread into this space of Boyer. In the paraglottic space, this space is situated lateral to the ventricle, and this is the paraglottic space lateral to the ventricle and the glottis. This is the ventricle and this is the glottis. So this space is paraglottic space. It's formed by thyroid cartilage. This is the thyroid cartilage laterally. Cricothyroid membrane. Cricothyroid membrane. Quadrangular membrane. Conus elasticus. And anterior reflection of mucosa of piriform sinus. Rhinky space is a submucosal space along the length of two vocal cords from superior arcuate line to inferior arcuate line due to the loose attachment of mucosa to the vocal ligament. Blood vessels and lymphatics are almost absent in Rhinky space, which prevents early spread of cancer. Rhinky's edema is a fusiform swelling of vocal cord due to edema in the Rhinky's space. Now, there are various congenital anomalies of the larynx, that is laryngomalacia, bifid epiglottis, laryngeal atresia, laryngeal web, laryngocele, laryngeal cleft, vocal cord paralysis, subglottic stenosis, and subglottic hemangioma. Now, coming to applied anatomy, spread of cancer in the larynx and laryngopharynx. So growths invading paraglottic space destroy cricothyroid membrane and present in the neck. Ventricle tumors invade paraglottic space and then spread transglottically. Vocal cord tumors involving thyroarytenoid muscle invade paraglottic space and then subglottic and extralaryngeal region. Laryngeal supraglottic tumors can travel to subglottic region to the paraglottic space along the inner surface of thorax. Piriform fossa tumors can come into endolarynx and fix vocal cord to the posterior part of paraglottic space. Now, key points to remember of this lecture. You should know what are the various parts of larynx. You should understand the diagram of indirect laryngoscopy, difference between indirect and direct laryngoscopy, then the sphincters of larynx, 3 tiers, functions of larynx, Nerve supply of larynx, that is the superior laryngeal nerve and the recurrent laryngeal nerve. Difference between adult and infant larynx and the mechanism of phonation by the myeloelastic aerodynamic theory. Thank you. हाँ, आ जाओ। हाँ, एक मिनट आता हूँ उधर ही आता हूँ।